Well, the first is the right diagnosis, because I think sinus headaches is a misnomer. Most patients believe that their headaches are coming from their sinuses. Most patients' headaches are not coming from their sinuses. In fact, if you look at the classification of headaches, and in particular migraine headaches, there's this enormous list of variants that are considered migraine headaches, and most patients will qualify as one of those variants. And so, again, it's our job to evaluate the nose and the sinuses. It may require a sinus CT, it may require a nasal endoscopy to see what the actual anatomy and the health of the sinus mucosa is to make that determination. But I would say that most patients, if they come in and sinus headache is their number one complaint, we will end up doing a thorough evaluation, maybe trying some nasal steroids if there's a little nasal inflammatory disease, but for most of those patients, they end up going to see a neurologist for treatment of their migraine headaches. A lot of those patients come in with a diagnosis of sinusitis. So they come in and on their reason for visit it says sinus infections. But when you ask them, their primary complaint is sinus headaches or sinus pressure. And the way that that's been perpetuated, and this is not a knock to urgent care facilities of any sort, but those patients have spent numerous visits going to urgent care, emergency rooms, just some acute care facility with the complaint of a headache, and they've gotten an antibiotic and a steroid, whether it's intramuscular injection or intramuscular plus oral, but they've been treated with some combination of antibiotics and steroids, and they get better. And so that just reaffirms in their mind, well, this was a sinus infection because I took antibiotics and I got better. Whereas really it was the steroid that gave them their relief. And whatever it was that was causing the problem ran its course. They got a steroid shot and they got better. So by golly, that's what they need, is an antibiotic and a steroid. So the antibiotic kind of tags along with the steroid, where the antibiotic really had nothing to do with the fact that the patient's symptoms got better. It was largely due to the fact that they got a steroid shot. But in that patient's mind, it solidifies that diagnosis of sinus headache. And so we have to re-educate the patient. When particularly easy for us when we're standing in front of a monitor showing them their CAT scan, their normal CAT scan, their aerated sinuses, their healthy looking septum, their nice normal turbinates, to say, you know, the turbinates can swell and can cause some pressure, and that can trigger a migraine headache, and that could be the source of some of that pressure. But it's not an infection. You do not need antibiotics. You do not need sinus surgery. Maybe you need a nasal steroid, but most likely what you need is management of your migraine syndrome.